We have two new studies that we've published, both systematic reviews, meta-analyses commissioned by the Diabetes Nutrition Study Group of the European Association for the Study of Diabetes, one of randomized controlled trials and one of prospective cohorts, the highest level of evidence that we use to inform guidelines, and these are intended to inform the update of our clinical practice guidelines from the Diabetes Nutrition Study Group. We actually wanted to synthesize the evidence based on these three pre-specified comparisons. One was low and no calorie sweetened beverages for sugar-sweetened beverages, what we're calling the intended substitution with energy displacement. The other being the standard of care substitutions. This is water for sugar-sweetened beverages, again with energy displacement. And then the third being a reference substitution, where we're going to compare low and no calorie sweetened beverages with water to really assess how it compares to that standard of care. What we found when we look at the first one, where we have the caloric displacement, we did find that when one replaces and displaces the calories from sugar-sweetened beverages with low and no calorie sweetened beverages, a reduction in weight, a reduction in body fat, an improvement in liver fat, and in general, reductions, although not significant, in 20 cardiometabolic risk factors that we looked at, and no indications of harm. When we looked at water for sugar-sweetened beverages, we didn't see any differences, but the directions of the effect did favor water as the standard of care. And when comparing the water to the low and no calorie sweetened beverages, we didn't see any meaningful differences. There were some differences that favored low and no calorie sweetened beverages, some differences that favored the water, but overall, no meaningful differences. So then we looked at the prospective cohorts. The prospective cohorts have the advantage is they have long longitudinal follow-up to really look at those patient-important, public health-important clinical outcomes like diabetes, cardiovascular disease, and death. So when we looked at those analyses, again with those three pre-specified comparisons, what we found was we did see the intended benefits again. So whereas where previous analyses and syntheses had looked at what we call baseline or prevalent exposures, so measuring the exposure to low and no calorie sweetened beverages at the beginning of the study and then looking longitudinally at outcomes where you see increased associations of risk. When we looked at these substitutions, we actually saw an improvement when the low and no calorie sweetened beverages were substituted for a sugar sweetened beverage. We saw improvements in incident obesity, incident cardiovascular disease, and even all-cause mortality. When we looked at water, we saw again the intended benefit of substituting water for sugar-sweetened beverages with that caloric displacement across many of those same outcomes. And we looked at the low and no calorie sweetened beverages for water, so getting at how does it compare to the standard of care, we saw no differences. Really suggesting again, and I think reinforcing what we saw looking at the cardiometabolic risk factors, we saw that this translated to these patient-important outcomes, and we saw the intended benefit. This is a good question. So how do our results compare with the new systematic review meta-analysis from the WHO that was recently published? So I think our results agree very nicely as it relates to the randomized controlled trial evidence, where they also showed that where you look at that intended substitution of a low and no calorie sweetened beverage for a sugar sweetened beverage, you do see the improvements in weight outcomes, in particular weight-related outcomes. So that very much agrees with what we found. And I think compliments to the WHO, I think they appreciated the nature of the comparator in their update of their meta-analysis, and that was something they added to this update. Where there is a departure, it really relates to the prospective cohort evidence, the observational evidence. Here, they're still relying on a lot of baseline prevalent exposure analyses where you're seeing this increased risk. We find that when we approach this to really mitigate some of the residual confounding versus causality using these epidemiological techniques, using substitution analyses, change analyses, whereas they show increased associations with diabetes and cardiovascular disease, we actually show decreased cardiovascular disease and no association with diabetes. We think these findings are important from a public health perspective from the standpoint that even on a population level, this means that we do again have another alternative. The consumer has an alternative to caloric beverages, sugar-sweetened beverages. They have the ability to select low and no calorie sweetened beverages, and they can be assured that they're going to deliver on the intended benefits without adverse effects or harm.